Good afternoon, dear friends. Natalia is with you on my channel where I share my personal experience and answer your questions. There has been a lot of hype in social networks regarding the use of aspirin and its analogues in the face of cardiomagnil, thrombo, and other medications. Some doctors suggest using it to prevent COVID-19 in the first place and to reduce the risk of thrombosis in the second. In addition, it is proposed to use it during vaccination to prevent the development of side complications. Thrombosis in COVID-19 is one of the factors determining the prognosis of this disease. Aspirin prescribed as a prevention of strokes and heart attacks really prevents aggregation, in other words, the gluing of platelets, thereby significantly reduces the risk of blood clots. As you know, with a coronavirus infection, the threat of blood clots is quite high. There is a question on the agenda. Who and how can aspirin help in a pandemic? There are reports in the literature according to which aspirin can reduce susceptibility to the virus, in other words, all those who are forced to take this drug for life. In particular, those who have suffered a myocardial infarction are less likely to get infected and get sick. Is it proven today? In order to resist the COVID-19 virus, two mechanisms are needed. The first is a direct impact on it in order to suppress the infection, and the second mechanism is associated with an impact on the immune system. I mean the ability of the drug to spur and activate the immune system. To date, there is no evidence based on the presence of such effects in aspirin. Taking aspirin to prevent blood clots in this situation is also very doubtful. In simple terms, there are drugs that have a direct effect on platelets. In other words, disaggregants aspirin belongs to this group of drugs. On the other hand, there are means that have a direct effect on blood clotting factors, I mean anticoagulants, which are currently widely used for the prevention of thrombosis in COVID-19. With this disease, blood clots are detected in the pulmonary artery, heart, brain vessels, kidneys, as well as the microcirculatory bed. It is assumed that associated coagulopathy lies in the development of this disease. Swedish scientists have revealed the fact that when a virus enters the body, a certain kind of protein is activated, which triggers a part of our immune system that increases blood clotting. At the same time, they found that the traditional drugs used by us to thin the blood in this situation do not help. Whether or not to take aspirin as a prophylaxis for COVID-19 is currently not fully understood. From my point of view, this is not justified. It is also necessary to take into account the fact that with constant, prolonged use of aspirin and its analogues, a number of undesirable side effects may occur, and first of all damage to the gastrointestinal tract mucosa, which in the future, in the case of a real collision with COVID-19, can play a cruel joke. If it is necessary to prescribe anticoagulants and glucocorticosteroids together, two rather aggressive, but at the same time successfully working drugs in the treatment of this disease. Subscribe and be healthy.